Hi there, I'm Stephanie with 9 Health. Today we are talking all things census, the 2020 census, what it means, why you need to do it, and also how it relates to the coronavirus, how things have changed because of the COVID-19 pandemic. I also have Dr. Payal Kohli with me. She can answer any of your coronavirus questions. And to talk about the census, I should say, I have Chris Barge. He's the VP of Strategic Initiatives for the Community Foundation of Boulder County, which is also part of the Complete Count Committee for Boulder County. And he'll explain what all of that means and why he's kind of our expert today to talk about the census. So first, Dr. Kohli, just give us an update on the coronavirus today over the last couple of days. What do we need to know?
One of the big developments today is that we did cross over into over 1,000 hospitalizations here in Colorado, which is certainly showing us that we're going to start to get to the point where our resources are going to get limited. We're working on building a makeshift hospital at the Denver Convention Center. And then we heard from the governor yesterday that the stay-at-home order has been extended through April 26th for the state, and the mayor has actually extended it through April 30th for Denver itself. So what all of this is telling me is that, we're still heading into that peak of the mountain where things are probably going to get a little worse before they get better. But the good news is we heard some preliminary data that the social distancing is starting to flatten the curve, that we're having decrease in the number of new cases that we're seeing and how fast they're doubling. And also that a new model has come out that they thought that the old model actually overestimated the number of presumed dead from this. So all of that has been somewhat positive and encouraging, but we're still kind of heading really into the thick of it. And we're not quite out of the woods yet, certainly.
Thank you for that update. Again, you can ask any coronavirus questions and Dr. Kohli will answer those. You can just ask those in the comments. We're mostly talking about the 2020 census today. 9 Health is a community partner of the census. Usually at our 9 Health fairs, you'll see a booth with the census set up. Obviously, we're not having our spring 9 Health fairs because of the coronavirus pandemic. Again, I have Chris Barge. He's the VP of Strategic Initiatives for Community Foundation of Boulder, also part of Complete Count Committee for Boulder County. First, Chris, talk about your role and your organization's role with the census.
It's funny, our community foundation and philanthropy in general largely was out of the picture 10 years ago at the last census, but so much has changed since then that we've been alongside a lot of our government and nonprofit partners in preparing for this for the last 1 or 2 years. And so at the Community Foundation Boulder County, we have partnered with Complete Count committees, about 5 of them actually, that have coalesced around our county, including in Longmont, in the city of Boulder, on the CU Boulder campus, which of course is now closed, with nonprofits across our county, and then with a super committee that tries to keep everything coordinated and communicating cleanly in Boulder County. Specifically, one of the things we did was we decided to raise a fund and provide some funding along with some other philanthropies, managed to get about $250,000 out there for nonprofits that hired cultural brokers. These are people who have shared backgrounds with traditionally harder to reach communities. And so we've got a team of about 21 people who are out there running a campaign. It was supposed to be an in-person campaign. And then, of course, just as we were ready to go, everyone was hired up, excited about their new job and the civic duty that they were going to carry out. There became a big, giant new rule, and that is no in-person communication. And so, I always said from the beginning that this is going to work because we are going to have a team of people who are passionate about this, and they're doing this like it's their job because it's their job. And that still holds. And so you wouldn't believe all the creative ways that these cultural brokers, these outreach partners have found in order to just reach through non-in-person methods the populations. That said, across the country, we are flattening the curve in the wrong way when it comes to the census, just like we're flattening the curve in the wrong way when it comes to the economy. The good news is people are behaving in accordance with all of the health guidelines. And the bad news is that this is having a negative impact on the census. So bottom line, please fill out the census. Go to 2020census.gov. Do it today. What that will do is, first of all, prevent the need for the census to get in touch with you because you've not filled it out. Secondly, that extra energy can be spent on trying to do outreach for traditionally harder to count populations.
Yeah, I got my postcard. We got several communications in the mail, but there's like the postcard looks like the blue postcard. There's a code on the front to fill out the census, but you don't actually need the code, right? You can just go on to that 2020 census.gov website and anyone can fill out their census and get it done.
That's right. If you have the code, that helps the census officials on the back end more quickly sort your information. However, they want you to fill out the census whether or not you have that code handy.
And talk a little bit, you touched on it a little bit, but a little bit more about how the coronavirus has changed how data can be collected for the census and what kind of challenges that's presenting to you guys. But again, if a lot of us are at home and you can go and use the internet, use your postcard code, go fill out your census. Just talk about some of the strategies you guys are using, especially to get to those hard to reach populations.
Yeah, so the way the census has reacted, first of all, is to postpone all of their in-person outreach. And, as we know, the governor's orders in our state and across the country are being updated constantly. And so we know right now that there will be no in-person interaction in the month of April. That would have been happening by now for sure. That time horizon may get updated and get pushed out farther. The whole collection process, which traditionally ends by the end of July, is being pushed a couple weeks into August now. And who knows how that will roll. One little funny story was that our outreach partner up in the mountains, and here we're talking about Nederland and all the little small communities, neighborhoods up in the mountains west of Boulder, she was being very creative. And so she made a video with a neighbor who lives up in the woods, and she rang the door at the fence, and it was this big burly sign that said no trespassing. And then from inside the cabin, they showed this guy putting on all of his prepper gear, complete with a gas mask and rubber galoshes. He gets all that strapped on, and he opens the front door, and she yells, "Hi, I'm with the census," and then he takes off running through the woods. And then it cuts and it says, "Fill out the census so that we don't have to come knocking." It's meant in good humor, but I think it spoke to kind of a common mountain attitude, which is, I don't want the government coming by. Okay, well then just fill out the census, and no one's going to come ring your bell at your fence. But there's all sorts of other creative ways that our census outreach partners are adapting to this. And because we were intentional about partnering with people who were already networked into these harder to count populations, they're able to call on all those ways. Everyone, whether they're involved in the census or not, is relating with one another. That's a silver lining. We're Zoom calling family and friends that we might have much less regularly been in touch with. And similarly, the hope is that our networks, which were informal, are being actually strengthened and reinforced by the process of being at home and saying, well, who can I reach and how can I reach them?
Yeah, and you talked about flattening the curve in the wrong way for the census, where you're not as many people have filled it out at this point. I did want to get an update on Dr. Kohli just about flattening the curve. And we've gotten some, glimpses that is working. So hopefully, the census will be able to resume some normal operations probably later this summer, but to get people to fill it out. But talk a little bit about how that is going and our social distancing. Is it working?
So as we talked about before, when you social distance, you see the effects of what you're doing really 2 weeks later. So what we're seeing now is really if you go in a time capsule, it's from our behaviors 2 weeks ago when we first started social distancing. And it's been really encouraging so far, because initially we were having a doubling of the cases in Colorado every 1.5 days. And the governor just told us yesterday that's now been flattened to every 6 days. The other thing we've seen that's been relatively encouraging is that our new cases are growing in what appears to be a linear fashion rather than an exponential fashion, which is also good. I will give the caveat, however, that we are still way behind on our testing, and we're only going to see the number of cases that we're testing. We're only going to find what we're looking for. And so I don't want us to get too much false hope in the fact that we're really, really on top of this, because one of the challenges has still been widespread testing. And until we do that, we can't really know for a fact just how effective our interventions are. So we think there's some preliminary data that what we're doing is starting to work. We know there's still kind of a long ways to go. And we also have to keep in mind what Dr. Fauci said yesterday, which was that as soon as we relax the social distancing and go back to our lives, we're going to see a big bump in the cases again. So the expectation until we have a vaccine or a treatment or both, it's really going to be hard for us to go back completely to the way things were before. And we have to all start coming to terms with that new reality for the time being.
Yeah, so it's good the census has come up with some other ways to do things. Again, I'm Stephanie with 9 Health. We're talking about the 2020 census right now, the importance of filling it out. Also getting an update on the latest with the coronavirus from Dr. Kohli. But just talking about how the coronavirus has changed the way the census is having to get your information this time. It happens every 10 years. You can go online this time and fill it out. So Chris, I wanted to ask you, the census helps fund a lot of important community resources, including some healthcare resources, emergency preparedness. Talk about how much money is allocated to be distributed after the census is completed, how that all works, and who determines how all that money is used.
The decennial enumeration of the census happens is happening now. It happens every 20 years. Certainly it's ongoing work that gets updated, and the demographers estimate and update that information. But the bottom line is that this nose count, which is baked into our Constitution, allows us to really delegate and distribute power in the United States. And also figure out how much federal funding is coming into the states. And what that means for Colorado is that we currently have 7 members of Congress representing Colorado. After the 2020 count, based on projections, we are supposed to get an 8th member of Congress. So this is worth no less than 1 member of Congress if we get this count right. Additionally, it's worth $13 billion a year in 55 different sources of federal funding that land in Colorado. And the top 5 allocations of that 13 billion is the largest slice is Medicaid. That's 5.1 billion of it. Direct student loans is 1.8 billion of it. SNAP, supplemental nutrition assistance, is 728 million annually. Medicare Part B is 786 million. Highway planning and construction is 641 million. And Pell Grants bring in 395 million to our state. So when you break it down across our population, filling out the census is worth about $2,300 each year times 10 years. So every person not counted in Colorado loses us $23,000 over a decade in federal funding that we're passed over on.
And again, it's required that we all fill this out. So, and you talked a little bit about how things have changed, but if you don't fill out the census has to come find you, right? To call you.
That's right. And, there's been a perfect storm of circumstances brewing over the census prior to the coronavirus. I mean, for one thing, the census has been massively underfunded by Congress for 10 years. On top of that, we're in a new technological era than we were in 2010. And so for the first time, we're doing a lot of online and remote methods that have not had the full vetting that they normally would have had due to the underfunding in Congress. And then finally, a lot of the rhetoric at the national level that has been really against immigrants and other minority populations has caused immigrant populations in particular to feel more fearful about filling out the census. The census is mandated to be something that everyone fills out regardless of their citizenship status. There was a request by the White House earlier last summer to add a citizenship question that got turned down by the Supreme Court. And so that is no longer a risk for our undocumented residents, but still some of that damage is done anyway. And so we head into this stay-at-home order already with sort of a perfect storm overhead. And that's part of why philanthropy and more local government and nonprofit leaders have been working to ensure a complete and accurate count this go round in a way that these stakeholders have not shown up before. We were frankly already worried, and now it's more important than ever with this extra challenge of doing all this without being able to meet in person.
And I mentioned, the census helps fund, as you said, Medicaid and other healthcare resources, emergency preparedness resources. Dr. Kohli is a preventive medicine physician. Just talk about, once we do get out of this whole coronavirus, COVID-19, on the other side of this, and we're, caring more about preventive health, the access to healthcare, why that is so important that those resources do get funded fully.
I think that's a really important question. And I think what we have to think about, we keep seeing every day the death numbers are increasing from the coronavirus itself. But really what epidemiologists are saying is that this is just the first wave. And the second wave is really going to come because people are neglecting their chronic health problems and they're not getting those screenings that we would have offered, for example, through the 9 health fairs. And so this is just the first wave of damage that the pandemic is doing. And we're expecting to see, you know, over the next several years, people with chronic health problems like diabetes, hypertension, and heart disease actually are probably going to do worse than they would have had this pandemic never hit. So now more than ever, it's really important to have funding for those types of health programs, because that is one way that we can really minimize the fallout from this pandemic, is to really address those chronic problems once we put out the fire that this pandemic is creating today.
And then Chris, I wanted to just kind of end with anything else that you wish people would understand about the census, any other information you want them to know. I think it's pretty telling that, you know, everyone that doesn't fill it out, that's $23,000 that our state doesn't get just for every person that doesn't fill it out. Is there anything else that you want them to understand about the census?
Yeah, it's beyond just the political representation and the federal dollars that hit our community. It is about how we understand each other and whether we know who lives among us and what our needs are on a population level. A project that we've been championing here at our Community Foundation for going on 23 plus years is a community indicators report. And 2/3 of the data that we use in order to put this report on the social, economic, and environmental health of our community together is the census. The census and the American Community Survey, which is part of that project. And so we're one of thousands of examples of organizations that are really working for the good of the community and really very, very, very reliant on trustworthy data at a population level. Whether you're a doctor wanting to know on an epidemiological level what the current trends are, or whether you are a city planner that is trying to figure out how big your roads need to be, or whether you're a school district that's trying to figure out where to put the next school as parts of your area are growing. There's so many other important civic uses for this information. And so I really, really implore everybody to take some of this time when they're at home. Remember that it's 10 questions, it takes 10 minutes, and it's going to impact the future of Colorado for the next 10 years. So if everybody can do their part, we're going to be much better as we emerge from this coronavirus.
Yeah, I think that's well said and a good thing to leave everyone with. Just fill out your census. It's 2020census.gov. There's also several phone numbers. There's a phone number for English, Spanish, Chinese, Mandarin, Cantonese, Vietnamese, Korean, Russian, Arabic. I'll post all those numbers in the comments once I get off here, so you have those phone numbers as well. Especially if you know someone in your community, even a neighbor that doesn't have internet access, needs to call. Make sure your neighbors are filling it out too, obviously from a distance, but say hi to your neighbors, remind them to fill out your census. And I wanted to say as well, if you have a medical question that you want answered, you can again post comments here, but also call our 9 Health Neighbors line, 303-698-4455, extension 2005. That line will connect you to our 9 Health medical volunteers. You call, leave a message, within 24 hours, a 9 Health medical volunteer will call back and answer your questions that you have. So it's a good resource for the community, especially for those neighbors too that might not have internet access. While you're telling them about the census, tell them about the 9 Health Neighbors line. I'm going to let both these guys go. Thank you so much for joining me. And again, if you have questions after we sign off here, go ahead and post those and I'll pass them along to Chris or Dr. Kohli and we will get them answered for you. Thank you so much.